The EP Podcast. Heard everywhere podcasts can be found, and always at theeppodcast.com.
And welcome into the EP Podcast, Evergreen Park's very own podcast covering Evergreen Park and the immediate surrounding area. And my name is Chris Lanuti. We come to you each and every Monday. Hannah will join me. And for a long time, sitting down here at my 9-foot homemade oak bar with people from all over the neighborhood stopping by and telling their stories, I never thought there'd be a time where I'd be down here by myself. And that's what it's been like for the last month. Now, if you listen to the regular show that comes out each and every Monday morning and is available when you wake up, the 30 minutes of good that is the EP Podcast, you've probably noticed over the last few weeks that Hannah is, of course, over a phone line. Actually, she's using an app called Podbean. You go to the eppodcast.com and you're on a device that does apps, you're probably going to get prompted, do you want the Podbean app? I tell you this because if you're able to download the Podbean app, you can participate in our new live shows, Wednesday night at 7 p.m. and Friday afternoons at 4 p.m. You see, that's how we're doing everything right now. That's how I talk to Hannah. That's how I talk to the guest. That's how I talk to you. You can be in the app, hit a button, and you're on with us. Plus, there's a live chat room you can type if you're shy. So whenever you hear phone calls lately, whenever you hear a guest, whenever you hear me and Hannah talking, at some point that was live at 7 p.m. on Wednesdays or 4 p.m. on Fridays. It's our way of trying to bring the community as close together as we can while we practice social distancing. And we're going to keep doing it as long as we need to support Evergreen Park. To give you an idea of what it sounds like, today I thought it would be interesting to just play the beginning of our Friday live show. We've got a great guest that kicks things off, and you get to hear all the fun music and liners and things that I get to hit on the app. And then after that, Lorainne Swanson, we talked to her earlier in the week from the Patch. She's got something for small businesses. But first, I went and I took a blood test to see if I had coronavirus. Let's find out what happened. On the EP Podcast, found everywhere podcasts can be found, and always at theeppodcast.com. You are listening to the EP Podcast from Evergreen Park, Illinois, on the south side of Chicago. We do live shows at 7 p.m. on Wednesday nights and then 4 p.m. on Fridays, and the full podcast comes out available everywhere podcasts can be found and always at the eppodcast.com every Monday by the time that you wake up. Hannah has joined me. I see her in there, which is very exciting. Hello, how are you? We're getting ready to start, and then we are going to get to Dr. David Beckmann very soon here in the program. He'll be jumping on the line. Local Evergreen Park doctor, one of the first to start drive-up coronavirus testing probably a month ago. He was on the show when he announced it. And today I went and took an antibody test to demonstrate it, and he's going to come out with my results, Hannah. We're going to find out whether or not that corona...
So he has the results that fast. That's amazing.
He's supposed to have them in 10 minutes.
Wow.
Yeah, he's supposed to have them in 10 minutes. But I think they're holding it off so he can tell me online how everything went. All right,
that's
so
amazing.
He's going to be jumping in there in just moments. So that's very exciting as well. So
Let's start with that.
I think I see him. He's online. Doc, are you there?
Yeah, he's on.
He's on.
Hey guys, how are you?
We're doing great.
Yeah.
I maybe you could tell me if I'm crazy, Doc. And Dr. Beckmann is from the Family First Medical Group. They're located over at 97th and Western here in Evergreen Park. And, it's a new practice over here, and he has been very, very involved in helping everybody through this COVID-19 crisis. He set up the drive-through testing for COVID-19. Now he's added drive-up antibody testing so you could find out whether or not you possess the antibodies, like you might have had it and not even realized you had it. Now you have antibodies that could fight it off, might make you more comfortable going out into the world. And I went in this, Doc, and, here's the thing. You make it as comfortable as you can possibly make it. But it's surreal to be in your car and go into a parking garage and everybody's in the gowns with the face shields and the masks and the gloves, and they've got the whole like an outdoor triage center set up, and you pull up in your car and everybody in all their cars are in a mask, and I'm like, this is like out of a movie. I mean, do you watch this and go to yourself like, this doesn't seem real, but it is?
It's completely surreal. Not only the setup there, just how much life has changed for everyone in general. Being stuck at home, not being able to go in a restaurant, not being able to go in a bar, not being able to go to a park. I mean, it's very mentally taxing on everyone, and it is very surreal.
And first of all, it's got to be draining on you and the people that are doing these tests, because I see it. I mean, you're so meticulous. When I pulled up, because I wanted to experience this before we talked about it, you know, even though I don't think I've had coronavirus, but I haven't gotten my results yet. I'm guessing you're holding them. We'll get to that in a second if you have them. Okay, but as I
do have them. Yeah.
Okay, all right. We'll get to that in 1 second. But as I'm pulling up, I'm noticing that the people that are working for you, I mean, they're changing their gloves in between every person. They're taking people's temperatures, but then they're dropping the little disposables there. Like they are as safe as they could possibly be. But that also has to be taxing on them, because they're trying to make sure they go through each and every step so they don't forget something, and make sure it's like, change the gloves, do this, make sure I do this. And you can even see when they're handling the gauze after they prick your finger, because that's what they do, Hannah. They stick you, they're like, okay, hold a finger out of the window. So
it's not like a nasal swab.
No. The
antibodies
are a blood drop. So they prick your finger so you're bleeding, and then they put it like in a little plastic tube, and then they're like, all right, and they give you like a little swab, and then they're like, apply pressure, and then you kind of drive off, and you're just kind of like, wow, that was quick, and also just like, I'm never going to forget doing it, Doc. So let's hear it. Do I have the antibodies or not?
Chris, unfortunately, do not.
I knew I didn't. I've been too safe, Hannah. I've been too safe social distancing. I haven't caught it. Too safe.
Man.
That's okay. That's okay. So I have to, I'm okay with that. I thought it would have been awesome if I had them. Like, I think my wife was rooting for it. She's like, then we'll all get tested, and then everything will be fine. And I was like, I don't think we've had it, sweetheart. I really don't.
You're exactly right. In fact, it's actually kind of disappointing seeing people when we tell them they don't have antibodies. It's a big letdown. It would be, I think, wonderful if a lot of people came in and they had antibodies and they didn't really have any significant illness. Then I think we'd feel a lot more comfortable about what the future holds for the next few months. But unfortunately, in your case, Chris, you do not have those antibodies.
All right, so let's first of all, I want to explain to everybody that and I want to give Dr. Beckmann a chance to explain, if you think that it's possible that you have at some point contracted this and that you're through it, okay, and you want to check and see if you have the antibodies, what is the process that people go through to go get that test from you?
So basically anyone who wants to get a test can get one. There are just a few things that we want to do. We do a screening video visit first, and the reason we do that is because there's some patients who've been recently ill, and those are actually patients that we would want to do a nasal swab for and not an antibody test, because the antibody test is going to give us results usually about 4 weeks after an exposure to an infection. So if you've been sick in the last few weeks, the antibody test is not really going to be very useful. It would be the nasal swab that would be useful. But the antibody test, if you were sick over a month ago, or you're just curious and you want to know, were you one of the people who were asymptomatic and infected, you do a video visit. We give you some background information on what the test is, what it's like, and then we set you up to come in and do the finger stick test that you had done. And that test is looking for 2 different antibodies. We look for IgM antibodies, which are antibodies that are formed pretty quick after you get an infection. And then you have IgG antibodies. Those are the longer-term antibodies that can provide protection, we think, at least for maybe a year, maybe 2, if you wind up positive for those antibodies.
Okay, so now that we know how people end up going and getting it and what the antibodies are, we go back to the fact that I don't have them. And, I'm 42 years old. I don't have any major health problems at all. Not diabetic, not obese. I'm not a fitness freak. I probably should run more. And it seems like right after the entire pandemic broke out, everybody was running except for me. But I otherwise am pretty okay. I don't have any asthma. I have a son that has asthma that only pops up when he gets ill. So that's been a concern for us. But otherwise, everybody else in the house is relatively healthy. So when I see what's going on, I see that this hits everybody. It's obvious it hits everybody, although it seems to still tend to go towards those that are, let's say, they have a health problem or they're older. How nervous should I be? And I ask that question because we still know that the death rate for this is probably 1% to 2% at worst, unless you're reading something different from what I'm reading. And then also, secondly, there's now a social thing where there are people on all ends of the spectrum here. Some people are putting on a mask. They're staying inside the house. They're wearing gloves while they're out just to go for a walk, all the way down to the people that still don't understand there's any such thing such as social distancing. They're wearing nothing, and they keep trying to walk up and give me a hug. I mean, I had somebody actually put their hands on me. I'm going to get in that story in a little bit. And I was like, what are you doing? It's a pandemic. No. I'm like, you don't touch people. And it's like, so there's this whole like array of people and what they believe is safe and what isn't safe. So where do you fall in it? Is it a mask all the time? Is it, just keep washing your hands and stay away from people? Like, where do you fall in it, Doc?
Well, I think that for now, like if you're out in public where you're going to be around a number of other people, I think it's reasonable to wear a mask or some kind of facial covering. And what people have to understand is that mask is not a protection for you, it's a protection for others. The masks that people wear and those facial coverings that people wear are not to prevent you from getting COVID. It's so that you don't have virus unknowingly and shed that virus around people that are more vulnerable. So I think at least for a period of time, wearing a mask when you're going to be around other people makes sense. Now, wearing a mask in your yard or going for a walk where you're not around other people and wearing gloves, that to me, I think is a little excessive. There's really no reason to do that unless you're going to be walking near a lot of people or you're going to be in contact with the public. So I think that you still have to take precautions. And you asked about how nervous you should be. You're right. The mortality rate is actually, I think, going to wind up being less than 1%. I think we only have a fraction of we've only tested a fraction of the cases that have actually occurred in the U.S. I believe that we probably have 2 to 3 times more cases in the United States than have been reported. So I think there are a lot of other people that have been exposed to this already, which means that the mortality rate is a lot lower than we thought. It's still more deadly than your typical influenza, but it is preferentially deadly for older patients and patients that do have diabetes, lung disease, immunocompromised conditions, obesity. Those are really the biggest risk factors for getting a severe case of COVID-19. And I think until we have a really effective treatment or a vaccine, there's probably going to still be some form of social distancing and trying not to go into mass gatherings. I think, unfortunately, and I know you're a big White Sox baseball guy, I think, unfortunately, with baseball and sports, it might be the better part of a year before those activities return to normal. And I think that if they did return to normal, they'd probably be the teams are playing, but there aren't actually spectators. That might be a prospect that we're seeing in the future.
So let me talk to you a little bit about the treatments, because I think that's the thing we're all waiting for. Everybody got excited about the malaria drug, and then after they did some more tests, they're like, I don't know if this really does anything. Now there's a new one that came out today, and I don't know if you saw it, from the University of Chicago, and the only reason that this caught my eye is because both sides of the political spectrum's websites, Fox News and CNN, both reported on it almost the same way, which is like impossible at this point. Like it's impossible to get those two websites to agree on anything, and they were literally reporting the exact same thing. And I'm like, wait, maybe this actually works, because they both had very positive responses to this drug that they're trying out. That University of Chicago did like a little bit of a test on it. They said that it worked out well, and the manufacturer's up like 15 points or something on the stock exchange today because people are actually buying it. If you had a chance to look at that, or I mean, if you haven't, I don't want you to have to comment on something you haven't looked at, but if you haven't actually looked at it, how much should we get excited about things like that? Or is that just us being hopeful we can get outside of our house soon?
I know. I think there is some hope. The medication that you're talking about is called remdesivir. It's an antiviral. And it had been used in a few patients early on in the pandemic in the United States. And there were some positive results from that. I think it's there's some cautious optimism that that's a treatment that for some patients will work. That malaria medication, the hydroxychloroquine, that's been used for a number of people who've recovered. I think Tom Hanks and his wife took that medication, and they and obviously they recovered and did okay. And then the other treatment that's being evaluated right now is the donation of convalescent plasma, which is basically donating a portion of your blood after you've recovered from COVID-19. Some of the most severe patients that are in the ICU who get the convalescent plasma of somebody who already recovered from COVID-19, there's some promise there too. A lot of encouraging signs with patients that are getting better within a matter of 24 to 48 hours after receiving that. So there are some signs here that there are going to be treatments that, at least for some people, will be effective. And I think there's probably not going to be a one miracle medication, but it might be a question of, okay, we've got 3 different options here. Let's figure out what this patient's risk factors are and which treatment might work best for them.
And you talk about all the different treatments. I've even read that some people that are on that are intubated, they're flipping them over on their stomachs, and they're seeing things like sometimes it works and sometimes it doesn't. And the follow-up question, what you were just saying is, I mean, I had a good friend of mine that was intubated about a week or so ago in Colorado, and he pulled through. He ended up putting a post on Facebook a couple of days ago. He was intubated for about 3 days. The whole family had COVID-19. He took a turn for the worst. He's a first responder. He's a 911 dispatcher, and he couldn't stay home. And eventually, and his wife was a nurse, and it moved through the whole family. And he ended up not doing well while the rest of them started to recover from it on their own. And they just dropped him off at the emergency room, didn't hear from him for several days, and just got updates once a day from the nurses. Now, if somebody ended up getting sick, I get the feeling, and you deal with patients all the time, you're going to have somebody who tests positive and be like, okay, well, I've been reading about this one thing. That's what I want. But what you're probably telling people is you gotta leave it up to the doctors to see exactly where you're at, because there's more than one different way to treat somebody when they actually have this, right?
That's right. And for the most part, those treatments, unless you're in a research study or unless you're in the hospital, those treatments are not approved like as an outpatient treatment. So, the patients that we've tested that have come back positive, most of them have been able to recover at home. And there isn't a specific treatment that you administer to those patients at home, the ones with a milder illness that recover on their own, which, by the way, I know we see all the statistics with the hospitalizations and the deaths. 80 to 85% of people that get this infection get a mild case, and they never go to the hospital. So just from a purely statistical standpoint, your odds are better that as long as you don't have these other medical problems, your odds are better that if you get this, you can recover at home. Of course, there are exceptions, but that's the thing with statistics. everyone can find a case where it argues against the statistics, but I think it is still important to know that there have been hundreds of thousands of patients in the world already that have gotten this infection and recovered. And so it's not all doom and gloom. It's serious, for sure. And it's completely altered the way our lives have progressed right now, and at least for the foreseeable future. But I think that there are signs now that we are getting a hold of it, at least in Illinois. Things seem to be bending a little bit.
Doc? Uh-oh.
Yep.
There he is.
There
He's
he
back.
is.
I was worried COVID got him. So the evil COVID monster got him. You dropped off there, Doc. But maybe we're having a problem with the connection there. You know what? I want to tell you this, and before we conclude here, I did want to just tell you a story that I have from this week. I have a friend of mine who is a registered nurse, and he has taken the opinion of this is ridiculous. I don't know why you would have to, because he isn't in the hospitals. See what I'm saying? So his thing is like, this is ridiculous. I understand medicine. This is like getting the cold. He won't put on a mask. He's like, just wash your hands. This is ridiculous. And he just doesn't get it. He's like, I don't know why everybody's so nervous about this, but and there are a lot of people like, look, this is the south side of Chicago. There are a lot of people walking around right now going, this is no big deal. I'm not worried about it. And you mentioned earlier, the mask is not really for me if I'm wearing it, because it's not really going to prevent me from getting sick. It's preventing somebody else. So those are the people I'm most worried about when I go out in the public. What do you say to people like that? If somebody's listening right now is like, this is ridiculous. This is not that big of a deal. Okay, the Spanish flu was much worse than this, and they went out and worked. So, like, what do you say to somebody like that?
I think it's an attitude that we've been able to embrace just because we're an advanced nation that has not had to deal with a lot of really infectious and contagious viruses. The problem is that this is a completely new virus to everyone in the world, which means that there is no such thing as herd immunity to this virus right now. I think that the people that say it's not a big deal may have the luxury of not having a serious medical issue or being vulnerable. The problem is that if you think it's not a big deal and you infect somebody, you might kill them. And I think that that's the point here, is that it may not be a big deal to the majority of people that are younger and healthy, and it might not make them that ill. But potentially, if you don't watch what you're doing and you're careless, a grandparent or a parent can die. And we've had some patients who've gotten COVID and their parents didn't make it. So it's a very real thing. We've had many patients who've had family members and friends that have died already from this infection. So it's not made up. It's a real thing. And it's affecting everyone.
That's Dr. David Beckmann. He is from the Family First Medical Group. I went and got my antibody test today, and I failed because I didn't end up with the antibodies, and I'm very, very disappointed about it. So it's not me. I'm not the little monkey from Outbreak, Hannah, that can save the world. I do not have the antibodies.
Oh, come on.
Okay, listen, if you want to go check out more about what Dr. Beckmann is doing, go to your FFMG. YOUR, and then for Family First Medical Group, it's ffmg.com, and they have right there, you can schedule an appointment. You can contact them about getting COVID-19 antibody testing. They're also doing the regular COVID-19 test to see if you have it, and all the details are there. Dr. Beckmann's there with a big smile on his face, standing in the middle of a wooded field. I mean, he looks dapper. Okay, I mean, you can kind of play the game when you look at his staff, like, I wonder which one is behind the mask who I'm talking to. That's what I was playing today. So, Doc, I appreciate you coming on the show. I appreciate you letting me try out the antibody test. It was quite an experience, and it's an experience that I think that people are going through when they are like, oh, I'm sick, or I might have this, and I don't think anybody really realizes what it's like to go and do it. You guys do the best possible way that I could even imagine it being done. I'm a very critical person, and I'm driving through this thing and I'm like, nope, this is right. Everything, I can't find anything to be nervous about. So I think you're doing a great job, and I appreciate it.
Thank you so much. All right.
Thank you, Doc.
Be well. Be well, guys.
You too, Doc. That's Dr. David Beckmann, and it's really nice of him to join us. And I apologize a little bit for some of the audio issues. I blame the app. I don't blame me. Okay? I mean, I just building relationships, supporting the community, and service. These are the things that Country Financial stands for. They're more than just an office you may pass by as you drive through Evergreen Park. They're neighbors who lend a helping hand and support the fabric of your community, including charitable organizations, sports, financial education, and civic organizations. And since Country is already your neighbor, they want to get together and chat. Call your local Country Financial representative, Mike Thauer, today at 708-425-1559 to talk about the things that are important to you and how he can help you protect them. Joining me on the phone line right now, Lorainne Swanson. She's the editor of The Patch, Evergreen Park, and she's been very, very busy over the last month or so covering everything local going on with the coronavirus. How are you, Lorainne?
I'm fine, Chris. I'm, just staying at home, saving lives. They don't need me at Christ Hospital.
No, they don't need me there either. That's for sure.
We love featuring EP podcasts on Evergreen Park Patch. You're a great addition. We're both here for the community, and so it's a great partnership, and we're very happy to have you.
Well, thank you very much. Now, you are doing something, or the Patch is doing something with local businesses, and it was something that we've been hoping to have you on to talk a little bit about, because that's been one of our focal points. We deal with so many local businesses here with the EP podcast. I'm constantly talking with all the business owners. I know what they're going through. What is the Patch doing? Can you tell everybody a little bit about it?
Well, in each of our patches, we're doing open close directories, and I've done we just want local businesses to let us know, are you open? What are your hours? What adjustments have you made to do business in a pandemic? There's been a lot of creative things. I had a lady who's a yoga instructor, and so, she's not getting paid right now, but she's doing Zoom yoga, having classes on Zoom. And I'm just amazed at all the very creative ways that businesses are adjusting. And, we want to see them come back. We want to, I just encourage everybody to shop local. I'm not a big fan of ordering from DoorDash or Grubhub because they're taking money out of the pockets of a family-owned, restaurant. I do a lot of, carry out, and I ask people to bring it out to my car because I'm just really trying to stay out of public places. I'm in that boomer remover group, so to speak. So I'm just going to sit it out at home. But what we want you to do, it's on Oak Lawn Patch. On Evergreen Park Patch and Oak Lawn and Payless and also Crestwood. I'm the editor of those patches too. Put in your local business and let us know what you're doing, how you're adjusting.
One of the things that Hannah and I talked about on our last Wednesday live show, and Hannah's got a background in journalism. She was a writer for a while. She was on TV news. I did 10 years of broadcast radio. And we were talking about, especially in the sports industry, but I guess it goes across all of media industry, is that this is a huge ripple effect on first of all, writers and broadcasters and, people like yourself and myself, just because of the fact that there's less to cover and it's harder to cover it and come up with content when you're sitting inside of your home. How are you dealing with that? How are you still able to put out what you're putting out on the Patch? Because it seems like you haven't slowed down, Lorainne.
Well, I think it's very important to, and I think our readers appreciate this, to put out information specifically, especially with coronavirus and how it's affecting, like, for example, one of the PACE bus routes is temporary. The 392 bus route is temporarily suspended because of low ridership. But, Dr. Beckmann and the antibody testing, I had a woman, I had interviewed her elderly father passed away of coronavirus, and she had some weird kind of bronchial thing. She wasn't sure if she had COVID or not, and so she's got an appointment to go and get antibody testing. She just came out of her 14-day quarantine. But just on the ground stuff, what's happening at the hospitals, nursing homes, what are some resources? I've also tried to keep it hopeful for people. And, what are the good things that community members are doing, neighbors are doing to help each other? I know that there have been some area community news chains there, and even papers like the Daily Herald and the Tribune, they're cutting salaries and laying off people. And, but, Patch, because of our platform, like I say, I think we were made to cover a global event and locally, like the coronavirus pandemic. It's only been like 28 days. It feels like it's been much longer, don't you think, Chris?
I looked at the calendar today and I was like, "Wow, it's just been a month. Feels like a year." And I think a lot of that comes from the fact that I'm living with 3 children, and they range from teenagers down to a toddler. And so I've got a really crazy house. Every single day I wake up, and I've actually gone to a schedule now where I have been trying to do most of my work in the evening, and then I sleep later. So like I'm on afternoons and my wife is on days here in the house. We've gone to shift work so we don't all kill each other. So
yeah. Well, I'm at home alone with 2 little dogs, and thank God I have them because they're good company and they get me out of the house. I do wear a mask when I go out, and I never had to worry about, how am I going to find antibacterial soap? I've just, I can't run into stores looking for stuff. I just try to, play it smart and order online. And, I want to tell your readers this, your listeners, if Walgreens, go through the drive-through where you pick up your prescriptions, and you can get supplies that you might need, groceries, cleaning supplies, your shampoo and your toothpaste, and they don't want you in their store either. And you can just buy it right there at the window, and they'll take your preferred card, and just like if you were inside the store. So I'm really trying to utilize that.
Lorainne Swanson is from the Patch, and she has this directory. Remember now, if you're a business, go to the Patch, get yourself in a directory, update what's going on with you. If you are not a business, but you want to know what's going on with all the local businesses around you, same thing. Go to the Patch, go check out what the directory says. And of course, the EP podcast will keep updating you on everything that we're doing. And Lorainne, I really appreciate you coming on. It was a great treat to have you on and talk a little bit about what the Patch is doing and everything else.
It's better than those crazy bond court stories I used to tell.
Yeah, the last time he came out with the murder and the mayhem and the dead guy, and that was quite a tale. You do tell some interesting tales, Lorainne.
Yeah, but it's still interesting. So everybody, be safe, be well, stay home, save lives, and practice social distancing. This will be over eventually. So you take care, Chris. Thank you for having me.
Another show is wrapped up. Another show's in the books. Another show is wrapped up. And then by the looks, it's going to be a good one. And we'll see you next week. And the nude is basement. Another show is wrapped up. Another show is wrapped up. Another show is wrapped up, and it's in the books. Another show is wrapped up. Another show is wrapped up, and by the looks, it's gonna be a good one. Nudie's Basement. Broadcast Basement. The Nudie's Basement. The Broad Basement. Slancha.
The EP Podcast. Heard everywhere podcasts can be found. And always at the eppodcast.com.
This is by Ariaman, Iriman. Pick 'em up, pick 'em up, pick 'em up now. When your day is long and your night is yours alone. When you're sure you had enough of this life, hang on. Don't let yourself go, 'cause everybody cries. They cry, they cry, they cry. And everybody hurts. Sometimes. Sometimes everything is wrong. Now it's time to sing along. When your day is night alone, hold on. If you feel like letting go, hold on. If you think you've had too much of this life, well, hang on, because everybody hurts. Take comfort in your friends, 'cause everybody hurts. Don't throw your hand, oh no. Don't throw your hand if you feel alone. No, you're not alone. If you're on your own in this life, the days and nights are long. When you think you've had too much of this life, it's time to hang on. 'Cause everybody hurts sometimes. And everybody cries. They cry. And everybody hurts sometimes. Oh, everybody. Oh. When you think you've had enough, I think I've had enough. I think I had enough. Woo!
We just made an REM song happy.
It was like Papo's punk there.